Hello everyone and welcome. My name is Motaz Daraghma, a research fellow at University of Missouri, Kansas. So today I will be presenting how AI is enhancing stroke imaging, from improving detection to predicting patient prognosis to optimizing workflow efficiency. Stroke is one of the leading causes of death and disability worldwide. When a stroke strikes, every second becomes critical. Blood flow to the brain is disrupted, and millions of neurons are lost every minute. This is why we say time is brain. Rapid accurate imaging becomes absolutely essential to save brain tissue. Typically, we start with non-contrast CT to rule out hemorrhage, then move to CT angiography to visualize blood vessels, and sometimes CT perfusion to assess tissue viability. However, interrupting these scans can be challenging even for experienced clinicians, especially under emergency conditions. Variability between readers, image quality issues, and time pressure can all impact accuracy. And that's where AI, particularly machine learning and deep learning, steps in. AI assists us in interpreting these images faster, more consistently, and with a greater precision. Today, we will explore three major studies that demonstrate how AI is reshaping stroke care. Now we start our first study. Aspects stand for the Alberta Stroke Program Early CT Score. It's a 10-point scoring system used on non-contrast CT scans to assess early ischemic changes in the middle cerebral artery territory. And as we see in the figure, each region corresponds to a specific part of the territory. When an area shows an early ischemic change, we subtract 1 point from 10. So a lower aspect score means a more extensive brain damage. The purpose of this study was to determine if a deep learning algorithm called SINA aspects could help physicians improve both their scoring accuracy and their interpretation speed. In this study, 200 stroke cases were collected across 5 clinical sites. 8 readers reviewed each scan twice, first without any assistant and then with support of AI tool. And a washout period was applied in between readings to minimize memory bias. The results showed that accuracy improved from 72.4% to 76.5%. The ROC area under the curve, which measured overall diagnostic performance, increased from 0.749 to 0.788. The average interpretation time decreased by about 6%. And importantly, agreement between readers improved significantly when AI assistant was used. And the clinical takeaways for this study is that AI tools can standardize stroke assessments, reduce variability between readers, and help speed up critical treatment decisions. Now we move to our second study. But before we dive into the study details, let us first quickly understand what radiomics means. Radiomics is a method that extracts a large number of quantitative features from standard medical images, like shape, texture, and pixel intensity. These features capture hidden patterns in the tissues that are not visible to the human eye, and they can be used by machine learning models to predict clinical outcomes. In this study, the researchers aim to create a radiomix model to predict stroke recovery after mechanical thrombectomy. They included 336 patients from 2 hospitals. On the CT images, they segmented 2 regions of interest: the thrombus, which is the actual clot, and the perithrombus, which is the brain tissue surrounding the clot. From these regions, they extracted 428 radiomix features using Python-based software tools. Then, they tested several machine learning models, including logistic regression, support vector machines, and random forests. The results showed that combining features from both the thrombus and perithrombus gave the best performance, achieving an area under the curve of 0.87. Among all the models, logistic regression provided the most stable and reliable predictions. And the clinical takeaway is that Radiomics can offer an early, image-based prediction of stroke outcomes after thrombectomy. And this can support physicians in planning rehabilitation, setting patient expectations, and personalizing care much earlier than before. Now, let us move to our third and final study. First, let us review what we mean by the first pass effect. The first pass effect happens when a blocked artery is successfully reopened with just a single thrombectomy attempt. Achieving first pass effect help patients get better clinical outcomes and experience fewer complications. In this study, the researchers aim to predict the likelihood of achieving first pass effect using AI models based on pre-treatment imaging. They studied 326 patients who underwent endovascular thrombectomy. The team trained a deep learning model using multiple imaging techniques, including non-contrast CT, CT angiography, as well as MRI sequences like diffusion weighted imaging, FLAIR, and ADC maps. The deep learning model they used was called the multi-sequence neighborhood transformer. It included attention mechanisms to help AI focus on the most relevant features within the images. Importantly, this approach was fully automated. No manual segmentation was needed, making it practical for fast, real world clinical use. Now, let us look at the results. The CT based model achieved an area under the curve of 0.8051, showing good sensitivity and specificity. The MRI based model also performed strongly with an area under the curve of 0.7967. The level of performance suggests that AI can help predict procedural success even before the thrombectomy begins. And the clinical takeaway that being able to predict first pass effect help physicians plan the procedure better by selecting the right tools, anticipating challenges, and optimizing strategies. This is especially valuable in time sensitive, resource limited settings where preparation can make a major difference in outcomes. And with that, we conclude our presentation. Thank you all for your attention.